Members of the Massachusetts Association of Health Plans are routinely rated the country's best for clinical quality and member satisfaction, focusing on ways to keep patients healthy and lower costs for employers, consumers, and the state. Member health plans have been pioneers in efforts to control cost, improve quality, and drive innovation, focusing on ways to make healthcare better, simpler, and more affordable. One example is how Fallon Health's Senior Care Options Plan Navigator focuses on meeting the healthcare needs of low-income seniors with complex health conditions by coordinating medical and support services to help them stay in their homes and active in their communities.
Every Navigator member, when they join with Fallon Health, is assigned a case manager who's a healthcare professional, either a registered nurse or a social worker, etc. And also what we call a navigator, a care coordinator, who works together with the member, their family, other members of the care team, so the PCP, any specialists that the member might be seeing, and works together with all of them to develop one single plan of care that everybody can use.
I was diabetic, and real wild diabetic. Nobody could control my sugar, no matter what. And once Navigator came in, they kind of straightened me right out.
With people like George, we set up a VNA nurse case manager that he mentioned that comes 3 times a week. So she's checking his sugars, he's getting his meals prepped for him and cooked for him, so he's eating the right foods. We sent him for his valve replacement, and I went with him to all of those appointments coming up. To that, I even went there to make sure he got checked in okay the day that he got his surgery. If we know that somebody's going in for a procedure, we usually try to communicate with their primary physician, at least the office or the nurse that's assigned there. And the nurse case manager will communicate with the members and make sure that they understand what they need to do before they go in. And then when they come home, we also check in on them and make sure that everything's going well.
I cannot say everything that Navigator has done for me. I cannot say it. It's so much. Like I say, I wouldn't be here if it wasn't for Navigator.
We'll always look at the needs of the individual member. And in the case of our Navigator members, these are our grandparents, our aunts and our uncles, our teachers. They're the people that took care of us when we were younger, and we owe it to them to give them the best that we can. And sometimes it's treating them a little bit differently than you would a commercial member. Thinking of social support types of things, Meals on Wheels. Are they eating enough? Do they have the refrigerator that can keep their food cold? How's heat in the wintertime? How are they going to get out to a doctor's appointment? So we'll provide transportation to that appointment, but sometimes even getting to the curb is going to be difficult for them. So it's really looking at what does it take to get them the services that they need.